Welcome back. In the previous sessions, we have understood how can we use the 10 electrodes to obtain the 12 leads or 12 images of the heart. In this video, we will discuss in depth the components of the image or the components of the lead, what we call the image analysis. If you see, let's go to the whiteboard and then go back to the presentation in order to understand well the components of the image. So, if you see, this is the heart, and as you have understood previously, the electrical system of the heart, which is the SA node, which is the pacemaker of the heart, the inner nodal fibers and Bachmann bundle go and form the AV node, which gives the his bundle, divides into right bundle branch and left bundle branch, which divides into left anterior fascicle and left posterior fascicle, and finally the effector Purkinje fibers. When SA node works and higher the electricity, it produces the atria to contract. The atrial contraction is imaged in the form of a wave. This wave is called a P wave. So the first part of the image is the P wave. Then the electricity comes to the AV node, which makes a physiological delay, which is a very short period of silence in which the heart not contracting or relaxing. So this part will be isoelectric. Then the electricity came to the ventricles, making the ventricles to contract, and this gives me a wave called a QRS wave. Then ventricle came to relax or repolarize, which is occurs into a wave into phases. The first one is isometric relaxation, give me a segment isoelectric one, then active relaxation, which gives me another wave. This segment called an BR segment. And this wave called Q R and S, QRS complex. This segment called ST segment. And this wave called a T wave. Again, when SA node fires its electricity, it causes the atria to contract, atrial contraction, producing a wave called B wave. So B wave represents atrial depolarization or atrial contraction. Then electricity came to the AV node, which causes a physiological delay. Give me a isoelectric segment called BR segment. Then the ventricle depolarize and contract, produced a wave in the form of complex called Q, which is the first negative deflection after BR segment, then R, which is the positive deflection, then S, which is the second negative deflection after the positive R. These three waves, QRS, called QRS complex, which represents the contraction of the ventricle. Then ventricle relax onto phases, isometric relaxation represented by ST segment, then active relaxation represented by the T wave. So the whole relaxation is composed of ST segment and T wave. Okay. In this scenario, there is something missing, which is, yes, as you said, atrial relaxation. Where is the wave of atrial relaxation? As you know, atrial relaxation occurs at the time of ventricular contraction or ventricular depolarization. So the small wave of atrial relaxation is hidden in the large QRS wave of ventricular depolarization. So it is hidden in the QRS. So I cannot see it from the standard ECG, right? Okay, greatly. And as we said before, that if we add a wave plus a segment, I can gain what is called interval. Yes. And I have two important intervals in ECG. The first one is the PR interval, which equals B wave, the plus BR segment. So this one is called BR interval. And we have another one very important called QT interval, which includes the start of Q wave till end of the T wave. This one called QT interval. And if you see, this includes ventricular depolarization and ventricular repolarization. So the QT interval represents the whole activity of the ventricle, depolarization and repolarization. Okay, these are two important intervals in the heart. And we have segments. The first one is the PR segment, and the second one is the ST segment. Yes, you are great. Let's go back to the presentation and see in depth these waves. Firstly, SA node, which is the pacemaker of the heart, started to initiate the electricity. So atrial depolarization and contraction occurs, producing the B wave. Then AV node produces its physiological delay. Give me an isoelectric segment called BR segment. Then the ventricles depolarize and contract, giving me the complex, which is the Q, then R, then S complex, in which the Q is the first downward wave of the complex, R is the first upward wave of the complex, and S is the downward wave after or preceding the upward wave. Then ST segment, which is the initial plateau phase of ventricular repolarization. And then the T wave, which is the rapid phase of ventricular repolarization. And there is a very small wave called U wave. What does U wave represent? It represents repolarization of Purkinje fibers. Sometimes it may be absent and its presence is a normal physiology, but sometimes may be due to certain pathologies, as we will discuss later. As we said, there is a two important intervals, the BR interval, which equals B wave plus BR segment, and we have a QT interval, which includes the Q wave and T wave plus ST segment. This is the QT interval. These two intervals are very important. At this point, we have finished the most difficult part in this basic level of ECG learning, which is the basic one, in which we have understood what is an ECG. And from the understanding of the definition of ECG, we have known its diagnostic value and how can we use it in diagnosing a wide variety of pathologies in the heart. And then we have understood the electrical system of the heart and its electrical activity, the coronary circulation. How can we record an ECG? How can we use the cameras, which are the electrodes, in order to obtain the leads, the ECG paper, the components of the image, and how can we anatomically divide the ECG panorama in segments in order to image the different walls of the heart. And at this level, you have mastered the most difficult part at all in all levels of ECG. Then you will enjoy analyzing and getting the best of knowledge of ECG. So the next lecture, we will give you the concept of secret codes and how we will do a code solving of ECG. Enthusiastic very much to see you in the next level. سوري شيل الحتة دي والنبي عزيز. I hope that you have enjoyed this part and got it well, and see you in the next lecture in which we will discuss the basic concepts of code solving and how and what are the 12 code secrets of the art. معلش برضو الحتة دي شيلها الأخيرة دي وحطها تاني. In the next lecture, we'll discuss the 12 ECG secret codes and how we will encode these secrets. See you